Honorable Segun Adekola Alexander.
I represent Esan Southeast, Esan Northeast, and I am from Edo State. Need to increase taxes on tobacco as a means of curbing tobacco use and funding healthcare services. The House notes that issues concerning tobacco and its various uses have engaged the attention of government all over the world because of the grave danger tobacco poses to human health and the environment. The House also notes that annually, tobacco use accounts for more than 7 million deaths around the world, thus resulting in decreased household incomes, increased government expenditure in healthcare provisions, and loss of productivity. The House further notes that even though it is a leading and avertible cause of non-communicable diseases, it remains a leading public health threat, as Nigeria, for instance, has an estimated 5 million smoking adults, who in turn expose 30 million non-smokers. I repeat that, 30 million non-smokers to harmful effects of secondhand smoking. The House is informed that an average smoker spends 2,000 naira on tobacco monthly, which averages to about 10 billion monthly for the 5 million adult smokers, thus amounting to 120 billion annually. For a product that causes cardiovascular and chronic respiratory disease, and which waste contains over 7,000 toxic chemicals that poison the environment, worse than gas flaring. The House recalls that the World Health Organization Framework Convention on Tobacco Control, WHO FCTC, was ratified in 2005, and Nigeria agreed to reduce tobacco consumption and prohibit duty-free sales of tobacco products, thus becoming the first African country to implement the requirements of the Global Adult Tobacco Survey, GATS. The House is aware that in 2008, the Nigerian Demographic and Health Survey, NDHS, carried out a survey which revealed that 9% out of the 11.5% of men between 15 and 49 years of age smoke cigarettes. The House is also aware that GATS data, GATS data, which was collected from the 6 geopolitical zones, was made to assist the country in enhancing its capacity to design, implement, and evaluate tobacco control programs and to fulfill its obligations under the World Health Organization Framework Convention on Tobacco Control, FCTC. The House is also informed that the tax being levied on tobacco products in the country is between 20%, is 20% of the retail price, a far cry from the World Health FCTC benchmark of 75%, and does not conform to international best practices when compared with the 80.5% in the United Kingdom, 43% in the United States of America, 49.3% in South Africa, and 52.3% in Kenya. The House further informed that taxes on tobacco contributes £12 billion in the United Kingdom and 14.1 billion in the United States annually, thus showing that a policy of increasing tax on tobacco will curb public health concerns and substantially increase revenue potentials of the government and help in mitigating the funding challenges of the healthcare services delivery. The House is concerned that the M-Power, not N, M-Power aims postulated by the World Health Organization have not been fully implemented by the federal government, namely, monitor tobacco use and prevention policies, that's the M, protect people from tobacco use, offer help to quit tobacco use, warn about the dangers of tobacco, enforce ban on tobacco advertising, raise taxes on tobacco. That's the power. Empower. The House resolves to, 1, urge the federal government to embark on sustained campaigns to control tobacco use. Implement the Empower policy package. Adopt stringent measures to restrict advertisement of tobacco products and promote smoke-free policies that cover public places to protect non-smokers from the harmful effects of second-hand smoking. 2, mandate the Committee on Finance to interface with the Federal Ministry of Finance to review the tax regime in order to increase the current tax on tobacco products, which percentage increase should be used to fund healthcare services. And 3, also mandate the Committee on Healthcare Services to ensure implementation and report back within 6 weeks for further legislative action. Mr. Speaker, my highly esteemed colleagues, I so move. Of the law my honorable member just quoted. But here is the point. All over the world, it's common sense when you have issues like this affecting the health of the people to have a tax system that can discourage them. But having also said that Nigerians signed on to the Empower. They signed on to it without knowing that they should review such things. So for me, Nigeria signed on to it. They were the first to sign on to it in Africa. So I am not saying anything different. The Nigerian government signed on to that, to raise taxes on this. So, Mr. Speaker, I am strongly in support of this. And if the Nigerian government says that VAT cannot be reviewed, they should not have signed on to this.
In favor of the motion, say aye. Those against it, say nay. The ayes have it.